Hello and welcome. Today, we're jumping right into a real medical detective story. It's a case that starts with a symptom every parent is familiar with, a simple fever, but it can quickly unravel into a condition that puts a child's heart in serious danger.
Really think about that. This is the question at the very heart of Kawasaki disease. It's an illness that can look a lot like other common childhood infections, but believe me, the stakes are so much higher.
So let's start our investigation with the first visible clues, the signs and symptoms that tell parents and doctors that something just isn't right. So what is Kawasaki disease? Well, at its core, we call it KD for short, it's an acute inflammatory disease. Now, it's self-limiting, which means it does eventually resolve on its own, but here's the catch. Its primary target is the blood vessels, and it almost always affects very young children, typically those under 5 years old.
Okay, so doctors are trained to look for a very specific set of clues. The big one, the main event, is a high fever that just won't break for at least 5 days. Along with that fever, they're looking for at least 4 of these other classic signs, those really distinct changes in the lips and mouth, a body rash, that puffiness and redness in the hands and feet, and a swollen lymph node in the neck. But this is where the mystery really deepens. What happens when a child has that stubborn fever, but doesn't have enough of the other clues?
Right, let's move beyond the outward signs like fever and rash. We need to uncover the real danger of Kawasaki disease, a threat that's completely hidden from view.
The fundamental problem in KD is something called vasculitis. The easiest way to think about it is to imagine the body's plumbing, all its blood vessels, getting inflamed, swollen, and damaged. And in Kawasaki disease, this inflammation has a very specific and very dangerous target, the coronary arteries. The crucial vessels that feed oxygen-rich blood directly to the heart muscle itself.
And this right here shows you exactly what that inflammation can lead to. On one side, you've got a perfectly healthy artery, but on the other, that's the result of vasculitis, an aneurysm. The inflammation weakens the artery wall, causing it to bulge out. It's literally like a dangerous balloon forming on a pipe. That weakened spot is just asking for blood clots to form, or in very rare and severe cases, it could even rupture.
So here's the bottom line, the thing you really need to remember. Because of its potential to cause this kind of damage, Kawasaki disease is the #1 cause of acquired heart disease in children in developed countries. This is not some minor illness. It's a major cardiac threat.
So how do doctors even see this hidden damage? Well, the key tool is the echocardiogram. It's a non-invasive ultrasound of the heart, and it lets doctors look directly at the coronary arteries to check for any inflammation, widening, or the formation of those dangerous aneurysms.
Now this is where our investigation gets really tricky. What happens when the disease doesn't play by the rules? When not all the classic clues show up? This is the huge challenge of what we call incomplete Kawasaki disease, or IKD. In these cases, a kid will have that persistent high fever for 5 days or more, but they'll show up with fewer than 4 of the other classic signs. This makes diagnosing it so much harder and can lead to really dangerous delays in treatment.
To solve this puzzle, doctors rely on a diagnostic algorithm, just like the one you see here. If a kid has that long-lasting fever but not enough of the other signs, they turn to blood tests. They're looking for sky-high levels of inflammatory markers. These are basically alarms going off in the blood, signaling a massive inflammatory response in the body. If those alarms are ringing, doctors then look for other clues from the lab work to build their case and make the call to start treatment.
And once that diagnosis is suspected or even confirmed, it is an absolute race against the clock. The goal is to get treatment started fast to prevent any permanent damage to the heart.
The standard of care is a powerful 1-2 punch. First up is a high-dose infusion of something called intravenous immunoglobulin, or IVIG. This is basically a cocktail of antibodies that works to calm down the body's haywire immune system and reduce that dangerous vasculitis. The second part of the attack is aspirin, first in high doses to tackle the fever and inflammation, and then in low doses to stop blood clots from forming in any of those damaged arteries.
And with this disease, timing is absolutely everything. This timeline lays it out perfectly. There is a critical 10-day window. Treatment works best when it's started within those first 10 days of the fever, and the real sweet spot is between days 5 and 7. If you wait until after day 10, the risk of developing those coronary artery aneurysms just skyrockets.
But of course, our medical mystery has another twist. What happens when the standard treatment, our best line of defense, just doesn't work?
For most kids, somewhere around 80 to 85%, that first dose of IVIG is like a magic bullet. The fever breaks and they start to get better. But for a stubborn 15 to 20%, the fever just keeps going. This is called IVIG-resistant KD. And these are the kids who are at a much, much higher risk of developing coronary artery damage.
So what do you do then? This is where it gets really interesting. This data compares the different second-line treatments, and what it shows is that for just breaking that resistant fever, a drug called infliximab seems to be the best bet. But, and this is the crucial part, when it comes to the most important outcome, preventing those heart aneurysms, all three options, whether it's infliximab, a second dose of IVIG, or steroids, they're all pretty much equally effective.
For most kids, thankfully the fever breaks, the mystery is solved, and they make a full recovery. But for some, especially those who had heart involvement, the story definitely doesn't end there.
Long-term vigilance is just key. We're talking regular follow-ups with a pediatric cardiologist for years. These kids will need echocardiograms over time to monitor their coronary arteries as they grow. And it really means a lifelong awareness of their heart health, managing risk factors, and getting personalized advice on what kind of physical activities are safe for them.
And we just can't forget the human side of this. This quote really hits home. The whole experience leaves a lasting psychological mark. Even for families whose kids came through with zero heart complications, that worry, it can stick around for a long, long time.
So, if you take away only one thing from all of this, let it be this: awareness saves hearts. Plain and simple. Recognizing the signs of Kawasaki disease and getting that treatment within the critical 10-day window is the absolute key to preventing what could otherwise become a lifelong heart condition.
And that leaves us with one final, lingering question. We still don't know what causes Kawasaki disease. It's still a mystery. So as we get better and better at diagnosing and treating it, what more can this strange illness teach us? Could we one day prevent it altogether? It's a puzzle that researchers all over the world are still working tirelessly to solve. Thanks so much for joining me.